Let us discuss interviewing patients on sweating. Inquiring about perspiration is especially important in relation to a diagnosis according to the 6 stages and the 4 levels, but it also elicits important information for the differentiation of deficiency patterns. Sweating imbalances can be divided into 3 overall groups: heart imbalances, deficiency conditions such as qi deficiency, yin deficiency, and yang deficiency, and invasions of pathogenic factor. Sweat is the body fluid associated with the heart and the fire phase, but many other organs' physiological relationships must also be taken into account when analyzing abnormal patterns of sweating. The pores in the skin are controlled by Wei Qi, which is the most yang aspect of Chen Qi. Wei Qi is controlled by Lang Qi and created by spleen Qi and kidney Qi. This means that a deficiency condition in one or more of these organs, as well as an overall yang deficiency condition, can result in the pores not being controlled optimally. When there is physical activity in the body, heat is generated, and this will drive the body fluids upwards and outwards. If Wei Qi or Yang Qi are weak, the pores will not be able to hold back the sweat, and there will be spontaneous perspiration or sweating on light activity. Sweat is created when heat evaporates qin. Qin is, amongst other things, a component of blood, and blood is governed by the heart. This means that imbalances in the heart can lead to abnormal sweating. This can be seen in more chronic imbalances such as heart yang deficiency or heart blood deficiency, heart fire. It is also seen in more transient disturbances of Shen, such as nervousness, which often results in spontaneous sweating. Spontaneous sweating due to heart imbalances will often be observed in areas of the body that are controlled by the heart channel, particularly the beginning and end of the channel, that is, the palms of the hands and the armpits. Invasions of pathogenic factor can interfere with sweating. Due to its yang nature, wind can spread and disperse Wei Qi, opening the sweat pores and thereby allowing itself and other forms of pathogenic factors such as cold to enter through the skin. Cold will, due to its astringent yin nature, contract the pores, closing them shut so that the person cannot sweat and thereby expel the pathogenic factor. One of the main signs that there is an invasion of pathogenic factor in the Taiyang aspect is that there is soreness and stiffness in the skin and muscles. This is because Wei Qi has been blocked by exogenous wind cold, the stagnation resulting in pain and discomfort. But also, importantly, a lack of sweating because the pores in the skin are contracted and closed shut. If the person is very Wei Qi deficient, they will sweat, but the sweating will not relieve the symptoms. This is because their Wei Qi is not strong enough to control the pores, so the person sweats spontaneously. Because the Wei Qi is so weak, it cannot expel the exogenous Xie Qi upwards and outwards. If wind heat has invaded the body, the yang nature of the heat will force fluids and thereby sweat upwards and outwards. The pressure of the sweat will force the pores to open, resulting in sweating. Once again, because the exogenous Xie Qi has not been expelled, the sweating does not relieve the symptoms. The difference here, though, between an invasion of cold when there is Wei Qi deficiency and an invasion of wind heat is that there will be signs of heat in the latter scenario. The pulse is often a good indicator when differentiating between the various types of invasion. An invasion of wind cold will usually manifest with a tight pulse, whereas the pulse will be empty if there is Wei Qi deficiency. Invasions of wind heat should be accompanied by a rapid pulse. In all 3 situations, the pulse will be superficial because the imbalance is in the exterior aspect of the body. If exogenous Xie Qi patterns penetrates down to the Qi or Yang Ming aspect, the violent struggle between Cheng Qi and Xie Qi will generate a significant amount of heat. The extreme heat will force fluids up to the surface of the body, resulting in profuse sweating. Because Xie Qi has now penetrated deeper into the body, the profuse sweating does not relieve the symptoms. The difference between wind heat and Qi level or Yang Ming heat is that the pulse and the sweating will be much stronger when Xie Qi has penetrated to the interior. If Xie Qi becomes locked in the Shaoyang aspect, the person will alternate between periods where they spontaneously sweat and have a fever or feel hot, and periods when they freeze and have chills. Importantly, there will be no sweating and fever sensations while they have chills, which is otherwise characteristic of invasions of exogenous qi in the Tai-Yang aspect. Yang deficiency and qi deficiency are not the only deficiency conditions that can cause sweating disturbances. A classic symptom of yin deficiency heat is night sweats. This is because yin should be able to anchor yang and thereby control heat. If yin is weak, it will not be able to control the heat at night, which is the period in which yin should be dominant. The heat will force fluids upwards and outwards during the night. The problem is compounded by the fact that Wei Qi, which controls the pores, does not circulate in the exterior at night but is in the interior. The pores are therefore not able to hold the sweat in the body. Night sweats due to yin deficiency can be a chronic condition, or they can be acute when exogenous qi has penetrated down to the yin level in a diagnosis according to the 4 levels. It is, however, important to note that night sweats are not always a manifestation of yin deficiency heat. Damp heat can also result in night sweats. Damp heat sweat tends to be more yellowish. You can ask the patient whether the sweat stains their sheets or night clothes a yellowish color. Damp heat night sweats are also more predominant on the head than the torso and limbs because damp can block the pores of the skin in the body, so the heat funnels the sweat up to the head. Yellowish and sticky sweat is, in general, a sign of damp heat, as in odorous sweat. So we have here tabulation of the causes of sweat. So sweating during an invasion of exogenous qi, which does not relieve the symptoms, indicates wind cold with concurrent Wei Qi deficiency wind heat. Lack of sweating during the invasion of exogenous qi signifies wind cold. Spontaneous sweating indicates yang deficiency or qi deficiency. Night sweats means yin deficiency, yin level heat, damp heat. Constant or profuse sweating would mean yang Ming stage or qi level heat or excess heat. Alternating sweating and chills, not simultaneously, Shaoyang stage. 5-palm sweating, sweating from the palms of the hands, soles of the feet, and the chest is yin deficiency. Yellowish or sticky sweat is damp heat. Odorous sweat is damp heat. Nervous sweating, especially in the palms of the hands and the armpits, is heart qi deficiency. Thank you all for listening.